2024, something happened that shook the medical community in Nigeria. The National Bureau of Statistics made a report stating that two-thirds of medical professionals, doctors, nurses, and midwives would demand for bribes before attending to patients. It's alarming, right? Because that is to say that in every 3 groups of people sitting here, at least 2 of them would demand for bribes before attending to their patients. But what if I told you that that is not the full story? Standing on the existing protocol, good morning the panelists, good morning my audience. I am Agochukwu Excel Mesomachi, a final year medical student from the University of Abuja. And on behalf of the authors, I will be presenting the study, Reassessing Bribery Among Nigerian Healthcare Professionals, an Expert Consensus Counter-Narrative Rebuttal. Next slide, please. Okay, as I said before, there was a report released by the National Bureau of Statistics, and there's an image that should be showing. Okay, this is the report. It was titled Corruption in Nigeria, Patterns and Trends, and it was supposed to highlight bribery among public officials in Nigeria, and it included doctors, nurses, and midwives. For some reason, the media particularly highlighted the part about healthcare professionals, and this image below, the headline, was widely circulated. But of course, the medical community pushed back, and they argued that this claim was, lacking context and professional insight. Next slide, please. And that is why this study set out not just to, investigate the claim because of what it implies, but also to explore the perception of healthcare professionals on bribery within the health sector, analyze factors influencing these perceptions, and examine the ethical considerations surrounding bribery and receiving gifts from patients. Next slide, please. Okay, for this study, mixed methods approach for qualitative and quantitative data was done. And we used a national online survey involving around 430 health professionals, including doctors, nurses, dentists, to collate the data. And these responses were collated from across the 6 geopolitical zones involving 33 states, including the FCT. These are the methods of data analysis and data synthesis. Okay, of course, there was ethical consideration with the involvement of the NMA and the NANNM. Next slide, please. Our key findings. Most of our respondents were within the ages of 36 to 45, had practiced for more than 10 years, and were mostly in the public sector. About 44% of them reported the claim as non-existent, as it is unethical and unacceptable to accept bribes. A significant portion, 33%, acknowledged it existed, but not among doctors and nurses, but however among non-medical professionals, while we had 9% stating that it was common practice, citing hardship, moral decline, and systemic corruption prevalent in the society as possible factors. Next slide, please. Most importantly, 99% of the respondents opposed the report by the National Bureau of Statistics, stating that 42% of doctors, nurses, and midwives received bribes. And there was no statistically significant association found between the socio-demographic features and perceptions of bribery in the health sector. Most of the respondents were surprised, outraged, and they believed it was a false accusation, the figures were exaggerated, and they believed it was also very unfounded. Next slide, please. On gifts versus bribery in healthcare, 34% of the respondents agreed that gifts are indeed a form of bribery, and they warned that it could, have impact on professional integrity, it had the potential to influence and bias, and it was unethical practice, while 65% disagreed, and they stated that gifts do not count as bribery, as they could just be, a token of appreciation rooted in ethics and culture, while we had 1% that were indifferent. Next slide, please. In conclusion, an overwhelming majority of healthcare professionals rejected the claim backed by the National Bureau of Statistics report that 2/3 of medical professionals demand or receive bribes before attending to patients, citing methodological flaws, lack of inclusion, transparency, and contextual accuracy. This study was more than just trying to refute the claim. It was a call for nuance, context, and also truth in reporting cases related to the healthcare space. Thank you so much.